A new bill making its way through the legislature could take power from local health departments and give it to city councils instead. 3 News Now's Alex Whitney reports from the Capitol.
When the COVID pandemic first hit, health officials were faced with a difficult task. They had to respond to an unknown disease spreading quickly throughout Nebraska. They had to make decisions, and they had to make them fast.
Contagion, which is usually caused by viruses in most cases or bacteria, but can be chemicals or radiation and things like that, really knows no time limit. And so the quicker usually that we can do something about it, the better. And usually we're talking minutes to hours, not days and weeks.
Health officials like Eshelman believe it was that quick reaction that helped prevent the loss of more life due to COVID and kept Nebraska's hospitals from collapsing under the strain of the pandemic. But those decisions would prove unpopular with many who felt directed health measures like mask mandates and social distancing were infringing on their constitutional rights. A new bill would leave it up to elected officials instead.
It means that only elected officials should have the ability to restrict those liberties. They are directly responsible to the citizens who elect them. Should those citizens feel a decision is not in their best interest, the elected officials will face an accounting at the ballot box.
LB 421, the bill introduced by Senator Kathleen Kauth, would shift Nebraska's health directors to an entirely advisory role. They could still make recommendations, but any action would have to be approved by a vote of a city council or county board. Multiple health directors, Dr. James Lawler, and organizations like the Nebraska Nurses Association testified against the bill, saying it would delay responses to health crises, putting people's lives at risk. County officials were also not pleased with the plan.
You can call emergency meetings for an emergency purpose. You have to have an agenda that clearly states the actions that you're going to be voting upon. And oh, by the way, when we're talking about an emergency, I think everyone has talked about how those things are sort of messy, to use the term of art that appears to be prevailing today. And so if numerous ideas are being batted around and an idea comes up that everyone agrees to, but it was not on the agenda, now we have to call another meeting.
Supporters of the bill argue that it adds another layer of accountability, but the health directors at the hearing reminded the committee that they do not have the right to do whatever they want.
Even if you're elected official, you answer to the voters. Same thing with me. I answer to a board that's comprised of elected officials and people appointed by county boards, et cetera, and technical experts. So absolutely, just like, we all answer to somebody.
In Lincoln, Alex Whitney, 3 News Now.
Today's hearing was just for gathering testimony. It will still be some time before the committee votes on whether to advance the bill.